there's a lot of individuals that just need a little extra care. They just need to talk to somebody. And that doesn't necessarily have to be in a hospital setting. That can be right in their own home.
Finding new ways to help people in a mental health crisis. New at 5, in so many cases, it's a police officer who will first encounter someone who needs help. Instead of forcing that person into a squad car and hauling them off to the hospital, sheriff's deputies in Ontario County have a new approach. News 10 NBC investigative reporter Jennifer Lukey joins us now to explain. Jen?
Yeah, Brett. Well, Ontario County has been part of a pilot program that puts iPads in sheriff's cars. When deputies respond to a mental health call, which they do several times a day, they make an early assessment. If the person agrees, they use the iPad to do a Zoom or FaceTime call with a mental health professional at Clifton Springs Hospital. That professional can better assess whether the person needs to be brought in for treatment by the deputy, or if they can provide some counseling over the iPad and set up outpatient options and transportation for them. The Sheriff's Department says the program has cut down on the number of mental hygiene arrests that it's had to make and freed up very valuable space in the Clifton Springs psychiatric wing, all while still providing help to those who need it. They also say it can be central in de-escalating situations, which leads to less use of force incidents.
When people realize that when we come in the door, we're not just going to swoop them away from, the comfort of their home and take them to the hospital, that in fact, we're here to help. And this is one of the tools in our toolbox that we can say, hey, you know what, we don't need to take you anywhere right now, but maybe you can talk to the mental health practitioner using the iPad.
We've seen a lot less people having to come to the hospital. We've seen a lot less, the things that are happening in the news. We know our individuals in the community, and now the police can join in on that.
Wayne County deputies are also part of this pilot program. It's proven to be very helpful in our more rural counties because, Brett, often the trip to and from the hospital for a mental hygiene arrest can take more than an hour, which cuts into the time that deputies have for other calls and takes him or her out of the county altogether.
No doubt about it. Jen, I'm assuming this is all voluntary on the part of the patient and discretionary on the part of the deputy.
Yeah, of course. If the deputies get there and it's a clear mental health crisis, the person is threatening themselves or others, they still, of course, the deputies have the ability to make that mental health arrest and bring them straight to the hospital. Or if the person doesn't want to use the iPad to talk with a clinician, they don't have to, but depending on how the situation goes from there, they could still be brought directly to that clinician.
All right. Very